All right, we're going to go ahead and get started. Thank you for being with us today. My name is Steve Anderson. I am the Vice President of Benefits here at A+ Benefits, and we are grateful that you've taken some time to be with us today to discuss some important changes that have occurred to the A+ Benefits Employee Medical Plan. We're excited about these changes, and we feel like it's going to be a great benefit to all of our participants. We're going to have a short question and answer period at the end of the presentation. So if you have any questions that are not answered, we're going to try to cover all the commonly asked questions. But if you have some questions that are not answered, you'll be able to come on the line and ask those, as well as I will be available for the rest of the day. And as well as EMI, if you have a particular situation about your situation, you're welcome to call and speak to EMI after the presentation. So effective June 1st of this year, EMI replaced Everest as our claims administrator for the A+ Benefits Employee Medical Plan. This change only applied to the medical plan. It has no impact on other policies like your dental plan or your vision coverage. The change also does not impact the basic plan design. So the option that you're on is the option that you're on, and there's not been a change to that plan. The medical plan is basically the same medical plan that it always has been. It's just a change in who does the plan administration. So instead of Everest doing the plan administration, now it's EMI that does the administration. This change also doesn't impact any limits or deductibles or anything that you've already met for the year. That information has actually been transferred from Everest administrators to EMI. So if you've met a deductible for the year, that information is already at EMI, and as they process your claims, they'll process those accordingly so that you don't have to have any new waiting periods. Credible coverage information is transferred over. Nothing resets with the plan because of this change. On May 20th, EMI mailed out new benefit cards to all the participants to be used on June 1st. So if you didn't receive a card, EMI, I think, will talk a little bit about how you can request a new card in a few minutes, talk about how you can log into their website and view your personal information and also request a new card if you'd like. It's important to note that Everest administrators will continue to process all claims that occurred May 31st and prior to May 31st. So if you have a question or concern about a claim that had a date of service prior to May 31st, you'll still want to contact Everest administrators about that claim. EMI would have, if you had a question for any date of service that occurred June 1st or after, then you'd contact EMI. So now I'd like to talk a little bit about EMI and why they were chosen as our new claims administrator. For the organization, they were founded actually in 1935, and since that day, they've continued to evolve into a highly successful insurance organization. They were formerly known as Educators Mutual, and their original focus was to bring insurance solutions to educators. In 2010, they changed their name to EMI Health to represent a broader focus, providing benefits along the Intermountain region. They're currently the 5th largest benefits provider in the state of Utah. They're recognized for their customer service. Their customer service surveys consistently are over 90%. And also, EMI has been awarded Utah's Best in State as an insurance provider 3 times, most recently in 2012. So we really feel like they're a very professional, quality organization, and that they're going to do their very best to make sure that our customers are taken care of. We anticipate that the participants will be very pleased with their interactions. I've worked with EMI now for almost a year on this transition, and I can say that in all my interactions, they've been extremely professional and responsive to any questions or concerns that we've had. I've enjoyed working with them, and I think that our participants will definitely benefit from their services. A+ Benefits and EMI both value very much our relationship with college services, and we want to do as much as possible to make sure that you have a positive experience. So with that, I'm going to go ahead and turn the time over to Tiffany Birmingham. She's a Vice President in Customer Service and Enrollment with EMI Health. She has part of her team there, and they're going to go ahead and go through some of the most commonly asked questions that our participants have. So go ahead, Tiffany.
Okay, thank you. I am very happy to be involved in this call today. Thank you for giving us the opportunity to be your company. I'm going to have Tony go over the summaries. We felt like it might be really beneficial to understand how to read those and at least find the information that you may need. So Tony Bonza, she is the manager over our customer service and enrollment area.
Good morning. So you've all received summary of benefits for your particular plan that you have signed up for. So I thought we would just run through real quickly on how to read the summary, and then we'll give you some more information on our customer service. So the summary is divided into categories. The first being general information, which talks about your deductibles and coinsurance maximum. As you probably know, deductibles are the first dollars you pay prior to services being covered by your plan, and the coinsurance maximum is the maximum amount of eligible charges that you would pay according to your benefit grid. So the first section that we come to is prescription drugs. And when you look at your summaries, you'll notice that in the black title boxes, we give information. So if there's a benefit limit or a cap on any of the benefits, that's where you're going to see this information. And then your copays will just be listed according to what type of services you're going to have. Preventative services, just keep in mind that you need to use a panel provider in order to receive the benefits, and most plans pay 100% of our allowed amount for your routine health care. Now, the plans do have a maximum, so please keep in mind and check that on your benefit summary. The next section on the summary is physician and professional services. These are your doctor's services, lab work, things like that. And if you'll notice, most of the time if you have services in a doctor's office, it's not subject to your deductible and usually paid in full of our allowed amount. So that's always a good option. Now, we can't always just use office services, so there are times when your deductible and your coinsurance will apply. So you'll see the deductible, any service that has a diamond in front of it is going to be subject to deductible, and any service that has an asterisk in front of it is not included in your coinsurance maximum. So an example would be your office visit copays. They do not apply towards that coinsurance maximum. The next section on your benefit grid is hospital services, and this is for inpatient, outpatient, emergency room, these types, anything that you have done in a facility or a hospital. The remainder of your benefit summary is just the miscellaneous benefits such as your rehab therapy, accidents, medical supplies, mental health, and some additional benefits that may be available on your plan. There's at the bottom of the second page, you'll see information on the asterisk, the diamond, and also the caret, which shows benefits that are limited to your alternative care setting, which does have a $5,000 annual maximum. So that's something you'll want to watch for. Now, the summary of benefits is just a brief description. If you have other questions or concerns, our customer service department is open from 8 to 6 p.m. You'll find our phone numbers and web address on your identification cards so that you can contact us directly. We have a whole staff waiting to hear from you. On the ID card, you'll also notice that it does list just a couple of benefit co-payments that you'll want to show to your providers when you go in, such as your office copay, urgent care. It also lists your deductible. Now, it's important to show your ID card to all of your providers, including your pharmacy right now while we make this transition. We do not use the same identification number that you had with Everest. We've had quite a few providers calling indicating that you were told you could use your same number that you had through Everest. That's not true. You need to use your new EMI ID number. And if you don't have your card for some reason, you may want to call our office to make sure we have your correct address, or you can go online, set up an EMI account, and you can order cards or contact us by email through your EMI account. Now, we're encouraging everyone to sign up for an EMI account because you can also check your claim status, look at your policy limits and benefits that you have, and check your eligibility for yourself and your family members. So please use our website. It's emihealth.com. And then you'll see just on the sidebar, My EMI Health, and you can just click there to sign up. If you have any questions or concerns, please call our customer service department. We're waiting for you. So also on our website, we have a provider search where you can search for participating providers to ensure that you receive the highest benefit. And I guess, Steve, we'll go back to you to see what you'd like to cover next.
We could go ahead and continue. I think Tiffany may have another couple of items to talk about, including some information about our pharmacy benefits. Is that right?
Yes. Go ahead, Nate. We'll
Okay.
let you talk.
Good morning, everyone. I'm Nate Gedge. I'm over pharmacy for EMI Health, and we'll welcome you guys to our plan. So the biggest difference with this switch is that you have gone from the second largest PBM, CVS Caremark, to now being part of the largest PBM as we use Express Scripts with pharmacy benefits. So with that, of course, as Tony just indicated, would be presenting your identification card at the pharmacy, as that will have the new member ID number and RX group number, which your pharmacy will need to be able to process a retail claim. Next difference between the two companies is the majority of the formulary is pretty much there. I believe the Express Scripts formulary has 98% of the medications in the same level that the CVS Caremark formulary did. However, there were a couple medications that will be going from a preferred status, which is generally is a 25% coinsurance, to a non-preferred status as a 50% benefit. And the biggest one of those that I've been able to identify would be Dexalent, which is a stomach pill, where the Express Scripts preferred brand is Nexium, or the generic versions of there's generic Prilosec and Prevacid. And the other medication would be brand name Synthroid for thyroid medications, and that would be a non-preferred medication, where with us, the generic formulations are the preferred products. We really encourage the use of generics. They will save you, the member, money, they will save your plan money, and they should have the same safety and effectiveness as the brand name counterpart on that. Another thing that we really encourage here at EMI Health is the use of mail order through Express Scripts. You're able to obtain up to a 3-month supply of medication at one time, which will save you trips to the pharmacy. Also, if you're on a generic medication, if you go to the pharmacy each month, it's $5 copay, where for a 3-month supply, it's a $10 copay. So you basically are able to save yourself one copay every 3 months on a generic medication. And Express Scripts is able to help that as well. Another change we've noticed in the first couple of weeks here are just some of the medications we do have require prior authorization. So we are just performing those prior authorizations. Generally, we approve them for up to a year. We just make sure that medications are being used for the clinical appropriate reasons. Some medications have state quantity limits. Most of those medications that we see are drugs like Lyrica for pain, or testosterone for hormone replacement therapy, or anti-nausea pills on those. And then also, one thing we want to encourage is, as Tony kind of indicated with our My EMI Health website, expressscripts.com also is a very useful site for you to manage your prescription benefits. So using your new EMI Health member ID, you can go to express-scripts.com, create an account with your EMI Health member ID, and from this website you could reorder mail order prescriptions. You can check on the status of those mail orders. You can actually check all your EOBs, so your claims, from a retail pharmacy or mail order, so during tax time, or if you want to see plan for future deductions on your FSA account. If you're going to go on a new medication, you can price those medications out. You can locate a pharmacy if you're going to be traveling, or if you would like to switch from one pharmacy to another pharmacy. And there's also some health and wellness links on there as well. So if you are diagnosed with diabetes or with asthma, you can click on those links for some tips to manage your health condition. I think that's all we have. So our prescription benefits should be pretty easy to use, we hope. If you have any issues, again, please call our customer service. They are eagerly awaiting your call. They all have access to our pharmacy system and will be able to answer any questions you have. Hopefully there will be very little to no disruption in your pharmacy benefit. And I'll turn the time back over to Tiffany.
So I'd just like to mention our account a little bit more in detail. If you do go in and set up your own personal account, I know we mentioned this a little bit earlier, Tony went over it, but you can also view your explanations of benefits. There's links to Express Scripts. There's a link to the provider search as well. You can request your card. Your summary of benefit grids are out there for you. It's your specific plan. The contract is also out there. And the way the contract is designed, it mirrors basically the benefit summary sheet. So the way the benefit summary sheet is laid out, that's how the contract is laid out as well. So it makes it pretty easy to identify where you're looking for certain question and answers. It's real easy to use. You can view your eligibility out there, of course, your dependents, your address, your claims that have processed or could be in process. And we've already had about 400 A-plus members set up accounts just since June. So that's not too bad. So maybe that's something you might want to look into. Also, if you do set up the account, that will have your, you're also electing to go paperless. So you will not receive the EOBs in the mail, and everything will be electronic, which is really nice. I personally think that. So that's all I have, Steve, unless there's something else you want me to go over.
Tiffany, would you mind talking a little bit about the network and how the network's changed and how to do a search online at EMI's website to find network providers?
Absolutely. So on our website, we have our provider search. You can locate it in a couple of different spots. Once you get in there, you can. It asks if you're looking for a medical option, which of course for you A-plus members, it would be the medical. And then it asks for your medical plan, which your plan would be the Care Plus plan. On your cards, we have identified your particular plan, but we also refer to it as Care Plus. That would be your first option. We're also going to have a copy of your card where you can refer to so you know what plan, how to look and identify what plan you have. And then also you would put in your state, and then you can search by your facility or a specialty or just by name. And then it will give you the search that you're identifying. You could also do search by a certain area. And it's very user-friendly. You can also print from this option as well, but I don't know that you need to do that because we're adding providers all the time. So that's why we like to refer you to the website.
Excellent, thank you. And Nathan, would you mind talking a little bit about if I had a mail order prescription that was with CVS, and I need to have it transferred over to Express Scripts, maybe the process that I need to go through. Do I need to still talk to my physician and have my physician transfer the prescription over? And if that's the case, I think I have the number, but if you could let everybody know what the number is to do that, that would be great.
Yeah. So the best way would be if you need to get a prescription out at Express Scripts, if it was at CVS or if it was at a local pharmacy and you want to start the service. One thing is with all the ID cards, we mailed a brochure, and in that brochure there is a new mail order prescription start form. So if you have an upcoming visit, just take that brochure with you to the physician. He or she can sign that, fill that out, sign that, and the doctor can actually fax that in to Express Scripts, which kind of speeds up the process. Or your doctor can call Express Scripts. I'll just give out the number. It's at 1-800-763-5502. I'll say that one more time, 1-800-763-5502. And so your prescription, so if you want to call your doctor's office, you can just call them saying, I need to have you call in a new prescription to my mail order pharmacy. Your doctor can call that into that number, get you started. Generally what will happen is, since you would be new to Express Scripts, you may receive a call from them just to verify shipping address, payment information for your copay and coinsurance. They may ask you if you're allergic to any medications, just a very basic questions that you would get at a local pharmacy too, to make sure that there's no drug interactions or safety issues with them giving you your drug. But mail order, generally your co-insurance should be less with mail order because we've been able to negotiate deeper discounts at the local pharmacy. So it's kind of a win-win where you get more medication for and save some gasoline trips in the car.
Excellent. Thank you. And it sounds like I did hear from one member that there is a possibility that in the brochure the number may be incorrect, but the number that you gave everyone is the correct number to have their physician call to have that prescription transferred over. So.
Yeah, we.
Okay, so.
We will verify that. I'm doing that, and so if you want to move on, I can jump back on a little bit and verify that.
Okay, that sounds good. All right, well, thank you, EMI, and they're going to go ahead and remain on the line, and we can open it up now to anybody that has a specific question that they would like to ask. So go ahead. If anyone is trying to speak and having trouble coming through, you may want to hit *6 on your phone, and that will let you come online.
I just have a question about the pre-existing condition thing. Does that apply or not? So I'm looking here.
Yeah, that's a good question. Pre-existing conditions are part of our plan, and that's something that will actually change with the Affordable Care Act in 2014, and partially has already changed. For children 19 and under, there are no pre-existing condition exclusions. For new participants who come on the plan that are over 19, there is a 1-year waiting period on all pre-existing conditions. If you've had a year of prior creditable coverage, and that includes being on the A+ plan or any other plan that you may have had in place, you would receive a certificate and you would want to submit that to EMI Health, and that would waive your pre-existing condition exclusions. So if you've already been on our plan for a year, transferring over to EMI will have no impact. EMI has already had that information transferred from Everest. They know if you've been on the plan for a year. So if you've already been on the plan a year or you've previously submitted your credible coverage certificate that shows that you've had 1 year of prior credible coverage, that will waive any pre-existing condition limitations. Does that answer your question?
It does. Thank you.
Excellent.
Does that also go for any pregnancies?
Pregnancies are actually an exclusion under the rule. There is no pregnancies are never considered pre-existing conditions. So even if you don't have prior creditable coverage, a pregnancy would not be excluded even if it was a pre-existing condition.
Okay. Thank you.
You bet. Anybody else? All right. Well, like I said before, you're welcome to call into A+ and talk with us. In fact, I can give you my direct line, and you're welcome to call me, and I'm happy to discuss any situation you may have. My number is 801-443-1195. That's 801-443-1195, and I'm happy to discuss any question you might have. Also, EMI, maybe you could talk about what your 800 number is. If you have a question that's related to a specific medical condition, I think they're a better resource. So go ahead, EMI.
Our 800 number is 1-800-662-5851, and you'll find this phone number on your benefit summary and your ID card. And we are here from 8 to 6, Monday through Friday.
Excellent. Well, thank you, everyone, for your time today. Again, we really appreciate the opportunity to work with College Services. We definitely value you as a customer and want to do everything that we can to make sure that this is as positive as an experience as possible. Thank you again, and have a great day. Bye.
Thank you.
Thank you.